Imagine for a moment your veins tirelessly at work, pumping blood throughout your body. But what if something goes wrong? Have you ever wondered what it would feel like to have a clogged artery? Today, let's delve into the fascinating and sometimes alarming world of blood circulation. Every step, every movement, relies on this incredible system. And when circulation falters, especially in the legs, feet, or, most critically, the heart, what happens? The answers may not be as obvious as we think. Did you know that a simple tingling sensation can be a warning sign? Or that constant leg fatigue might be more than just tiredness? Here at Health Dose, we will explore the mystery of clogged veins. We will uncover how the lack of circulation affects every part of your body and, more importantly, what you can do to keep your veins free and healthy. Have you ever considered how small changes in your daily life can have a significant impact on your vascular health? Join us on this fascinating journey through the human body. After all, understanding is the first step to prevention. And prevention? That is the key to a longer and healthier life. So, let's discover together what really happens when a vein gets clogged. A clogged vein, or venous thrombosis, brings about sensations that should not be ignored. The most common symptom is localized pain, often felt in the leg, which can be described as a cramp but more intense and persistent. This pain is often accompanied by swelling, a clear sign that something is amiss with circulation. The affected area may also become red and warm to the touch, indicating inflammation due to the blockage in the vein. So, let's understand the main symptoms of a clogged vein. One of the most common and initial symptoms of a clogged vein, also known as venous thrombosis, is swelling in the affected area. This swelling occurs due to the accumulation of blood that cannot circulate properly through the obstructed vein. For example, in the case of deep vein thrombosis, which usually occurs in the legs, the affected limb may exhibit noticeable swelling. This swelling may be accompanied by a sensation of heaviness or fullness in the area, especially after long periods of inactivity, such as sitting or standing for extended periods. In addition to visible swelling, a difference in skin temperature over the affected area may be noticed, usually warmer to the touch compared to other body regions. This symptom is indicative that blood flow is being impeded from following its normal course, leading to blood accumulation. Swelling caused by the clogged vein should not be ignored, as it can be a sign of a more serious condition that requires immediate medical attention. Early assessment and treatment are essential to prevent complications and ensure a more effective recovery. The second common symptom of a clogged vein, or venous thrombosis, is pain or tenderness in the affected area. This pain often presents suddenly and can range from mild to severe. Typically, the pain associated with a clogged vein is described as a cramping or heavy sensation and may be exacerbated by movement, such as walking or extending the leg. This symptom is particularly concerning because it indicates that blood flow is obstructed, which can lead to complications if not properly treated. In addition to pain, there may be a sensation of warmth in the affected area, accompanied by redness or a change in skin color. This alteration in skin color and temperature is a reflection of inflammation and blood accumulation in the area. In more severe cases, pain and swelling can intensify rapidly, requiring immediate medical attention. It is important to remember that even if the pain seems bearable, the condition may be a sign of a more serious problem, and thus, medical evaluation is crucial for accurate diagnosis and effective treatment. A third significant symptom of a clogged vein, also known as venous thrombosis, is a change in skin color in the affected area. This change in color can range from a reddish hue to a bluish or pale coloration, depending on the type and severity of the obstruction. This symptom is particularly noticeable in cases where the clogged vein is located close to the surface of the skin. The change in color is caused by altered blood flow, which affects the oxygenation and nourishment of the tissues in the region. In addition to the change in color, the skin over the clogged vein may appear stretched or shiny, and in some cases, it may feel warmer or cooler to the touch compared to unaffected areas. This symptom is a clear indication that something abnormal is happening with blood flow and, as such, should not be ignored. The presence of abnormal skin color, especially when accompanied by swelling or pain, is a strong indicator that medical evaluation is necessary. Early diagnosis and proper treatment are crucial to avoid more serious complications associated with clogged veins. A fourth significant symptom of a clogged vein, known in medicine as venous thrombosis, is a sensation of warmth in the affected area. This symptom can be quite distinct, where the skin over the obstructed vein feels notably warmer to the touch compared to other areas of the body. This warmth results from inflammation and increased blood flow as the body attempts to bypass the blockage. The sensation of warmth often accompanies swelling and pain, forming a set of signs that point to the presence of venous obstruction. In addition to the sensation of warmth, there may be a slight redness or discoloration in the area, which is also a reflection of inflammation and increased local blood flow. It is important to pay attention to this symptom, especially if it appears suddenly or is accompanied by other signs such as swelling, pain, or changes in skin color. The presence of this symptom indicates the need for a medical evaluation, as it may be a sign of a condition that requires immediate intervention to prevent more serious complications. The fifth symptom of a clogged vein, or venous thrombosis, can be stiffness in the affected area. This stiffness results from the swelling and tension caused by venous blockage. When a vein becomes clogged, the blood that should pass through it accumulates, causing swelling and increasing pressure in the area. This can make the region stiff and difficult to move. For example, if venous thrombosis occurs in a leg, the person may have difficulty bending or moving the affected leg due to the stiffness and discomfort. Furthermore, stiffness may be accompanied by a sensation of weight or tension in the area, making everyday activities that require movement more difficult. This symptom may not be immediately associated with a clogged vein, especially if there is no intense pain or visible swelling, but it is an important indicator that something is not normal. The presence of stiffness, especially if it is persistent or accompanied by other symptoms such as swelling or skin changes, should be a reason to seek medical evaluation. Early diagnosis and treatment are essential to prevent complications and ensure the patient's health and well-being. The sixth symptom of a clogged vein, a condition known as venous thrombosis, is the formation of visible and dilated superficial veins in the affected area. These veins, which may appear as blue or purple lines, are a sign that the venous system is trying to compensate for the obstruction in a deeper vein. This phenomenon occurs because the blood, unable to flow normally through the blocked vein, seeks alternative routes through smaller and more superficial veins. These veins, not adapted to withstand such a volume of blood, can become visibly dilated and more prominent. This symptom is not only a visual indicator of a problem in blood flow but can also cause discomfort or sensitivity in the area. The dilation of these superficial veins is a body's reaction to keep the blood flowing despite the blockage. If what I shared so far has resonated with you, I have something special that will interest you. Don't miss the opportunity to transform your life and start living your healthiest self today. By acquiring the ebook Secrets to Unshakable Health, you will have a guide with practical and proven strategies for living a longer, disease-free life. Click on the link in the first pinned comment and discover the path to lasting and robust health. It is important to be attentive to this sign, especially if it appears suddenly or is accompanied by other symptoms such as swelling, pain, or changes in skin color. The presence of dilated and visible superficial veins is a reason to seek medical evaluation, as it may indicate an underlying venous condition that requires treatment. Combating the lack of circulation in the legs, feet, and heart requires, first and foremost, a change in lifestyle, focusing on healthier habits. One of the most effective measures is regular physical exercise. Activities like walking, running, swimming, or cycling significantly improve blood circulation as they stimulate the function of the cardiovascular system. Low-impact exercises, such as gentle walks, are particularly beneficial for beginners or those with mobility limitations. Regular physical activity helps strengthen the heart and improves the blood's ability to flow efficiently through the veins and arteries. In addition to exercise, maintaining proper posture during long periods of sitting or standing is crucial. Staying in the same position for an extended period can impair circulation, especially in the legs and feet. Therefore, it is recommended to take regular breaks to move, stretch, or change position. For those who work while sitting, short walks or stretching exercises every hour can make a significant difference. Similarly, for those who stand for prolonged periods, it is important to change position and, if possible, elevate the feet when resting to facilitate venous return. Another important aspect is diet. Consuming foods rich in omega-3, antioxidants, and fiber helps improve blood circulation and cardiovascular health. Including foods like salmon, red berries, nuts, and leafy greens in the diet can significantly contribute to the health of the arteries and veins. Moreover, it is essential to stay hydrated as water is vital to maintain blood at the right consistency for efficient circulation. Avoiding excessive consumption of saturated fats, sugars, and salt is also crucial, as they can lead to artery hardening and other circulatory problems. A second fundamental aspect in combating poor circulation in the legs, feet, and heart is managing body weight. Excess weight can significantly increase the risk of circulatory problems, as it puts additional pressure on the heart and blood vessels. Weight reduction through a balanced diet and regular physical exercise can alleviate this pressure and improve circulation. A diet rich in fruits, vegetables, whole grains, and lean proteins, combined with reduced consumption of processed and saturated fat-rich foods, is an effective strategy for weight loss. Stopping smoking is another crucial step in improving circulation in the legs, feet, and heart. Smoking is one of the major risk factors for poor circulation as it narrows blood vessels and increases the risk of clot formation. Moreover, smoking also damages the walls of arteries and reduces the amount of oxygen in the blood, further hindering circulation. Quitting smoking has an immediate and significant impact on improving circulation and reducing the risks of heart and vascular diseases. Additionally, stress management is important, as chronic stress can contribute to poor circulation. Relaxation techniques such as meditation, yoga, or deep breathing exercises can help reduce stress and promote better circulation. Stress triggers the release of hormones that can narrow blood vessels, while relaxation helps dilate them, thereby improving blood flow. Integrating relaxing activities into daily routines can be an effective way to manage stress and improve cardiovascular health. The third vital topic in combating poor circulation in the legs, feet, and heart involves the use of medications and medical interventions when necessary. In certain cases, especially when poor circulation results from underlying medical conditions such as diabetes, hypertension, or high cholesterol, medication may be essential. Medications like statins, which help reduce cholesterol levels, and antihypertensives, which control blood pressure, can significantly improve blood circulation. Additionally, anticoagulants or blood-thinning medications may be prescribed to prevent clots, which are a common cause of blockages in veins and arteries. For more severe cases of poor circulation, medical procedures may be necessary. These include angioplasty, where a small balloon is used to open a blocked artery, and the placement of stents to keep arteries open. In extreme situations, vascular surgery may be required to remove blockages or repair damaged blood vessels. These procedures are typically reserved for cases where the risk of severe complications, such as heart attacks or strokes, is high. It is important to regularly consult with a physician and undergo tests to monitor cardiovascular health, especially if there are risk factors such as a family history, advanced age, or pre-existing conditions. The doctor can assess circulation and recommend the best course of action, whether it be lifestyle changes, medication, or medical procedures. Maintaining open communication with healthcare professionals and following their guidance is essential for preventing and treating circulation problems in the legs, feet, and heart. And there you have it, folks. We've reached the end of our video today here on Health Dose. We discussed the sensation of having a clogged vein and how it affects circulation in the legs, feet, and heart. We've seen that symptoms can range from swelling and pain to changes in skin color and stiffness. Most importantly, we talked about effective strategies to combat this condition, including physical exercise, maintaining an ideal weight, quitting smoking, and, in more severe cases, the need for medication or medical procedures. Remember, the health of your heart and circulatory system is crucial for your overall well-being. Small lifestyle changes can make a big difference in your health. And of course, always consult a doctor for proper advice and treatment for your specific conditions. Like the content? Don't forget to leave your like, it really helps the channel grow and bring important information to more people. And if you're not already subscribed, subscribe to Health Dose for more videos on health and cardiology. Share this video with friends and family who are also interested in these topics. Until next time, and remember, taking care of your health is the best prevention dose.